Hello and welcome to our program, In the Know, keeping pace with news and updates on COVID-19 vaccines. The CME program is supported by an educational grant from Janssen Therapeutics. Before we start, please take a moment to answer the pre-polls in the tweets below and let us know who you are. This is a CME certified program. Details regarding how to obtain your credit are located in the tweets below. Be sure to watch our handles for additional CME COVID programming, as this webinar is the second event in a series of 3 newsrooms. And follow Bonum CE for CME certified programs on Twitter. So I'm Dr. Tara Smith. I'm an infectious disease epidemiologist at Kent State University in Ohio, and I'm joined today by my colleague, Dr. Ogbuagu.
Hello, everyone. My name is Dr. Onyema Ogbuagu. I'm an associate professor of infectious disease in the Yale School of Medicine.
Our disclosures are shown on your screen. Our program today is the second in a series of newsrooms about COVID-19 vaccine updates. So head to Bonum CE on Twitter to catch up on our other discussions regarding COVID-19 vaccine developments. So these are today's learning objectives. So we will translate the data regarding the effectiveness of the COVID-19 vaccines in use in the United States and distinguish the data regarding vaccine effectiveness against circulating variants of concern. So these are the topics that we will be discussing today. And the first article I will discuss will look at COVID-19 incidence and death rates among unvaccinated and fully vaccinated adults with or without booster doses during periods of Delta and Omicron variant emergence. And this was published in the Morbidity and Mortality Weekly Report in 2022. So the purpose of this study was to assess the impact of full vaccination with and without booster doses on COVID-19 case and death incidence rates during pre-Delta, during Delta dominance, and the Omicron emergence period. So this was using case control data reported weekly from 25 state and local health departments in US adults between April and December of 2021. Moving from left to right, we see unvaccinated individuals with the numbers and their weekly incidence, fully vaccinated individuals with their number and their weekly incidence, and then the average weekly incidence rate ratio for all of them. And so looking down this table, again, you have pre-Delta from April to May 2021, the emergence of Delta in June, when Delta was predominant in July through November, and then Omicron in December. So looking again at unvaccinated and fully vaccinated individuals in those time periods, looking at cases, and then below you have the deaths for those individuals as well. And these are plotted out more graphically in this slide. So again, you can see unvaccinated individuals on the solid red line. The green hashed line are the fully vaccinated individuals. And where that gets dotted after October of 2021, those are the fully vaccinated but lacking a booster. And this red dashed line at the bottom are the fully vaccinated who have the booster. So that it was available as of October 21. So that group is added in there. And the colors you can see going across these graphs show which variant is dominant. Initially the wild type, and then you see Delta move in kind of the teal color, and then Omicron moving in the yellow. So you can see which period these are all in. So you can see that with the emergence of the Delta variant, that both cases and deaths went up very dramatically in the unvaccinated in that red solid line group. But you can see that while with the fully vaccinated in the green dashed line, those did go up for cases and a little bit for deaths. It was not nearly as dramatically as the unvaccinated individuals in this cohort. And you can see that those who were not only fully vaccinated, but also boosted, also, while cases still went up in the Omicron era, for any fully vaccinated individuals, those deaths were pretty flat. While you can see those increasing in the unvaccinated, and you can see cases increasing very dramatically in the unvaccinated during the Omicron era. So takeaways, in this large US-based multi-state study, COVID-19 vaccination showed good protection against both SARS-CoV-2 infection and also deaths, even as the Omicron variant became predominant. Protection against both infection and death was higher among booster dose recipients, so that was still important. And it should note that the data don't address the durability of protection, and this ended at the end of 2021. So you had only a very short period of time in which Omicron was dominant in that era. So we still need more data for that.
Now let's talk about the neutralization of SARS-CoV-2, the Omicron variant by the Pfizer vaccine. And remember that in December, this variant emerged, and we all had questions as to how well protected individuals who had received prior vaccination series would do. So these data were really important to provide very early information around how well two vaccines, and I think in addition, some individuals who'd received 3 vaccines did against the Omicron variant. And so this study, using sera from individuals who had received BNT162b2 or the Pfizer-BioNTech vaccine, looked to see if their sera was able to neutralize the Omicron variant. And in this study, they tested sera against the original Wuhan strain, but also the variants of concern Beta, Delta, and Omicron using pseudoviruses. A subset of these participants actually had live SARS-CoV-2 virus variants tested. There was sera on file for about 50 participants who had either received 2 or 3 doses from prior or ongoing trials. And so this figure shows the pseudovirus neutralizing titers for individuals after receipt of 2 doses or after receipt of 3 doses. And shown here in the different colors, light green for the Wuhan strain, yellow for Omicron, darker green for Beta, and the light blue for Delta. To the left are neutralizing assay titers against each of these variants for those who were 21 days after a second dose. So these are fresh off of receiving a 2-dose series of the Pfizer vaccine. And then to the right are the same evaluation done, but this time 1 month after individuals have received a 3rd dose. So this is comparing 2 doses to the left to 3 doses to the right. You start to see differences in neutralizing titers to the different variants, with Omicron being lower than Beta and then Delta in that order. You see that for individuals who received 2 doses, majority of the neutralizing titer measurements fell below the level of detection, which was concerning. So this made it pretty clear that a 2-dose Pfizer vaccine did not provide sufficient neutralizing ability against Omicron variant. However, it's a different story when you look at recipients of the 3-dose vaccine. Then you see, first of all, increases in the neutralizing titers against all the variants, including the variants of concerns, as mentioned. Omicron still had lower neutralizing titers compared to other variants, but we now see that most measurements were way above the level of detection of their assays, suggesting that the 3rd dose provided significant boost in neutralizing titers against the Omicron variant. Just pulling out the data for the Wuhan strain and Omicron, as was shown previously, again, it's just a nice way to highlight that there was almost no detectable activity for most individuals when it came to the live neutralizing titers compared to those who received the 3rd dose. So the previous data was looking at pseudoviral titers, and this is now for live SARS-CoV-2 neutralization of these variants. Again, robust impact of the 3rd dose on neutralizing titers against the Omicron variant. And so in summary, pretty clear that after 2 doses, Omicron neutralizing titers were quite low, and for most measurements below the level of detection. But when you measured or did those same experiments 1 month after the 3rd dose, there were significant increases, 23-fold increase relative to 2 doses for Omicron neutralizing titers after the 3rd dose. And interestingly, when you compared the neutralizing titers post 3rd dose to what you found for post 2 doses against Wuhan, it appeared similar, suggesting that the 3rd dose of the Pfizer-BioNTech vaccine restored neutralization levels that really should have mimicked that that you achieve from 2 doses with less immune evasive variants, which was very reassuring. Again, this is laboratory data, and clinical data continues to be gathered about the efficacy of the 3rd dose in protecting against Omicron, as was previously presented. Now let's look at the vaccine effectiveness against hospitalization in a South African healthcare worker cohort. And these were in individuals who received the homologous booster with the Ad26-CoV-2 vaccine, which is the J&J vaccine, during a period where Omicron was predominant. This is preliminary results from the Sisonke study. In this study, they're examining the effectiveness of the booster dose of the J&J vaccine given at a range of 6 to 9 months after the primary dose. This was a case control study involving hundreds of vaccination centers in South Africa across all 9 provinces of South Africa. The population here were healthcare workers, and these were admissions occurring November 15 through December 20, 2021. Remember that this part of the world experienced the Omicron wave prior to other parts, and which explains why data was collected as early as November 2021. In this table, we show the proportion of tests that were performed, positive tests, and admissions stratified by vaccination status, but also time after receiving the second or booster dose of the J&J vaccine. To the right in the table, we show the age stratified similar outcomes describing proportion of tests done, positive tests, and admissions within those demographics. A few things are worth highlighting from these tables. Again, the vast majority of positive tests occurred in those who were not vaccinated. That was about 91% of tests, and admissions also occurred among the non-vaccinated, or about 97%. Now, when they try to drill down to the positive tests as well as admissions among those who received the J&J vaccine, they try to explore the relationship between time from booster to amount of protection enjoyed against having a positive test and a hospital admission. And here they found that from 0 to 13 days after dose 2, positive test positivity was about 2.7% for those who had received it 0 to 13 days, and about 1.4% admissions. The numbers increased to 4.4% at 14 to 27 days post dose 2, which is 2 weeks to 4 weeks roughly after dose 2. There was a little bit uptick in positive tests. However, admissions remained pretty similar or low. When you looked at the data even further at 1 to 2 months post J&J vaccine, the numbers of positive tests were quite low at 1.5 and 0.4. And so what we gather from this is that it appears that there may have been a little bit of a drop in protection against infection initially, comparing those who were more than 2 weeks out post-dose compared to under 2 weeks. However, when you follow them a little longer, the numbers still held up that the vaccines continue to provide significant protection against admissions, with only 3 people within those timeframes who were vaccinated admitted to the hospital. So again, vaccination providing robust protection and a lot of information to be learned as to the durability of protection. Note that looking at the age stratified data, that a majority of the infections occurred in those without a prior COVID-19 infection. I think this is a great representation of vaccine effectiveness over time. To the left is the national data, and to the right are the data from Gauteng, which was the epicenter of the Omicron epidemic at the time. And so we see that it appears that the peak vaccine effectiveness appeared to be between 14 to 27 days, and it flattened out at 1 to 2 months against hospitalization. However, when you look at the data from Gauteng, where Omicron was circulating, you see a little bit of a loss of vaccine effectiveness, even as early as 2 weeks post-booster. So while these data are reassuring for the somewhat restoration of protection against severe disease requiring hospitalization in this cohort of individuals, I think it does raise questions around the durability of immune protection, and we look forward to having more of that data over the coming months. So the key takeaways from this data are that very early data show that receipt of a homologous booster in healthcare workers, an at-risk group, 6 to 9 months after initial vaccination, increased their protection against hospitalization from the Omicron variant, but protection appeared to wane, so we would all need to follow up longer data.
Thank you so much for joining us today. Please make sure to claim your CME credits by completing the post-test and evaluation form at the link on the screen, and make sure to follow Bodum CE on Twitter to stay tuned for more COVID-19 vaccine content.